In this narration number 3, we're going to talk about, we're going to start with talking about irritable bowel syndrome, or IBS, and move into liver disorders and pancreatic disorders. So first, IBS is fairly common, and it is different from inflammatory bowel diseases, which are like IBD. So IBD is a disease, IBS is a syndrome, and it's just a collection of symptoms. We don't really know what causes IBS. A lot of people who have IBS have other stomach problems as well. So they'll get just upset stomachs a lot, and stress will make them get an upset stomach, and things like that. So we do know that stress exacerbates it. It's not caused by stress, but stress can definitely make the symptoms worse. Usually people who have this have IBS with diarrhea, and a stressful situation will sometimes bring on a bout of diarrhea, and then once they poop, they're all better. So, if they have IBS with constipation, then we do have to treat the constipation, and we'll talk about that when we talk about farm. There are a couple of drugs that are specifically for that. If it's IBS with diarrhea, though, we just give them antidiarrheals. And it's not so one of the things is that when people have diarrhea, we want to know what's causing it, and we don't want to give them antidiarrheals, because if it's a stomach bug or something, then you need to get it out, and if you got C. diff, it's like, well, you need to get it out of your system. This is different, and so we know what's causing it, and they'll just keep Imodium in their cabinet, basically. So, Imodium is pretty much the most common of the over-the-counter diarrhea medications, because it's just for diarrhea. Pepto also works for it, though. All right. Vascular insufficiency. I talked about this a little bit in class. Just at the tail end of class, I think, is where we were with this stuff. So, vascular insufficiency means that you have a decreased blood supply to your stomach and intestine. Now, there are 3 major arteries, or 3 major blood supply systems, okay? And you've got the celiac one, the superior mesenteric, and the inferior mesenteric. If you just have one of them clamped or ischemic, then you're okay. You have to have 2 of them before you're really going to get ischemia. Now, if you're having surgery on your abdomen and we have to clamp one, not a big deal, because we're only clamping one. If you have a profound hypotension, then we've got an issue, because at that point, remember, if your blood pressure's low, your body diverts blood away from your GI tract. It is not an essential organ. Things that are essential organs are your heart and your brain. And so what'll happen is your gut isn't getting any blood, okay? So you got no blood supply. And when that happens, then we have an issue with the gut, the tissue in the gut actually infarcting. So anything can infarct. We've talked about this before. It doesn't have to be your heart. And you end up with a dead gut. If you have a dead gut, chances are you're going to die. And it's awful to say, but it's true. Okay. A lot of times, though, it may or may not be that kills the patient. A lot of these patients are in the ICU with sepsis, and they've got a super, super low blood pressure. Okay. Now, other things that can cause this, and I didn't talk about this in class, but if you have a clot in one of those arteries, then we've got an interruption of blood supply. If you've got a clot in 2 of those arteries, then we've got a problem. Okay. And then chronic arterial insufficiency. This is going to be kind of the same as when we talked about peripheral diseases. So peripheral arterial disease, when we talked about that, where that artery is insufficient for one reason or another. It might have plaque buildup, and maybe something like that. Okay. All of that can cause vascular insufficiency. Obesity, we talked about. This is a BMI of greater than 30. We know that this is a major cause of morbidity and mortality. It contributes to a lot of diseases. We do know that it is not just a psychological thing. We do know that there are there's resistances to hormones. So the hormones that I asked you to know are insulin and leptin. You know that insulin carries glucose into the cells. Leptin makes you feel full, okay? And if you're resistant to leptin, then you just keep eating, okay? Anorexia and bulimia, we talked about these as well. Remember, these are the psychological conditions. They are diagnoses. They are mental health diagnoses. So you'll talk about those more in mental health. Anorexics are typically, excuse me. Oh man, big yawn. Anorexics are typically smaller than bulimics. There is a type of anorexia that is a binge and purge here. So that's a different that's different, okay? Anorexics usually die of heart failure. It is a starvation induced heart failure. And they will stop menstruating. They often get down to a just a hugely decrease in body weight. They have fat depletion, muscle depletion as well. And they're like 60 pounds. So you need a medical provider in there as well, but you also need mental health providers. So bulimia is a binge and purge thing. And remember that bulimia is often diagnosed by a dentist because it erodes all the enamel on their teeth. Because they vomit so much, they will often have erosions in their esophagus. And okay, seriously, I keep yawning. They'll have erosions in their esophagus. Those erosions can start to bleed. They can get the fistulas between the trachea and the esophagus, which is very dangerous. We're going to talk about congenital tracheal esophageal fistulas in the PEDS narration. If you haven't already listened to that, that's in there. All right, starvation. This one, if you listen to the PEDS narration, this is detailed out there. What I want you to pay attention to on this slide in particular is the term cachexia. Cachexia is a condition. Cachectic is the adjective that we use. So if you think about your end stage cancer patients, how their skin and bones, that's cachexia. And it is a starvation. And you have no body fat, you have no reserves at that point. Okay. This is a short-term starvation. Long-term starvation that lasts for years and years is either marasmus or kwashiorkor. And that's and you see pictures of people in third world countries. And that's in the pediatrics because typically that's what they show you. So I talk about that because it starts in peds. All right, now let's talk about some liver failure. So when we have liver failure, you often will get portal hypertension. Okay, you'll get portal hypertension. Now, portal hypertension can also cause problems with the liver. So, portal hypertension defined is an abnormally high blood pressure in the portal venous system. Okay, so that is your portal vein, and the portal system is the blood supply within the liver. Okay, if that can get high, you can get portal hypertension from right-sided heart failure. So if you think about it, when you have right-sided heart failure, remember that backs up to the body. And if it backs up to the body, one of the first organs it hits as it's backing up is the liver. So that blood backup causes the portal system to become engorged. Okay. And so, because of that, then that is going to be it's going to cause hypertension. Okay. That's what we call a prehepatic, portal hypertension. So because it's happening at something, before the blood leaves the liver. Okay. consequences, you don't need to know the pre and intra and post, okay? An intrahepatic would be something is actually damaging the liver inside, clearly, okay? But let's talk about the consequences, because that's the important thing. And you've got some pictures. You'll have so this, for example, is showing esophageal varices and also some splenic varices and some gastric varices. And a varice is a varicose vein. So if you think about when you've seen varicose veins, and I remember back to last semester when we talked about varicose veins, and you saw them in legs, okay, they're these like really engorged veins and stuff, okay. That is exactly what an esophageal varice is. So it has backed up from the liver, okay, into all the other veins, okay? And so now it's backed up into the esophagus, into the blood vessels in the esophagus. And so now we have these huge, bulky, tortuous veins in the esophagus. And the issue with that is that if you eat something that is scratchy, it can scratch them open. So this picture right here is showing splenomegaly, okay? Because you can see where the arrows are kind of outlining it there on the picture, okay? Because it's also going to back up into the spleen, and that spleen is going to get engorged. By the way, you also get splenomegaly from heart failure. Now, all of this pressure, let's think back to edema, okay? Remember that when we have that increased vascular pressure, that hydrostatic pressure pushes out and into the interstitium, right? Well, when you're talking about your abdomen, the interstitial space that all that pressure pushes the fluid out of your blood vessels into is your peritoneum. Okay, so this is what we call ascites. So this man has liver failure. Not just the ascites that I want you to notice here. This is all fluid. If you flick it, you will see ripples of fluid go across. You'll notice it's clearly pushing on his lungs, right? Okay, he looks comfortable, but I don't know that he's really comfortable, but so this fluid is all pushing up on the lungs there, and as a result, they often get short of breath, especially when they're lying flat. And when they're standing up, it kind of falls down. So one of the things that we can do is we can actually suction out that fluid. We literally put a needle in and hook it up to a suction container to do that. And it sucks all the fluid out of it. It's called a paracentesis. Thoracentesis is what we do to suck it out of the pleural cavity. And then a pericardial centesis is when we take it out of the pericardial sac. So anyway, the other thing I want you to notice about this is that you can see the veins, okay? Visual blood vessels, or visible blood vessels, that shouldn't happen on the abdomen, okay? Now, if you got somebody that's super, super pale and they're skinny and you can kind of see them, that's different, okay? I'm talking about you can actually like map out these veins here, okay? That is indicative of liver failure because everything is engorged, okay? So there's your varices, your splenomegaly, and your ascites, and those are all symptoms of portal hypertension. All right, hepatic encephalopathy. When while you're listening to this, you're probably listening to this after we've done pharm, and I talked to you about the laxative that we give that helps clear the ammonia out of their system, and that's to treat this. So hepatic encephalopathy happens because ammonia builds up. Now, when you eat protein is broken down into ammonia, and other things too. But the liver clears that, okay? Ammonia is a neurotoxin. If you can't clear ammonia out of your system because your liver has failed, then it builds up, and as a result of that, it is toxic to the brain. And you get mental status changes at first, but then you can eventually get seizures, coma, and death, okay? And the way we treat this is actually giving them this laxative. It's called lactulose. And as a result of that, they just poop out all the ammonia. We also prevent them from making a whole lot of ammonia by really restricting their protein intake. All right, jaundice is yet another symptom of liver failure. Okay, obstructive jaundice means that the liver is not able to excrete everything that it needs to excrete. So obstructive jaundice would be like you've got gallstones and they're blocking the bile duct. Okay, fix that and we're all good. Okay, so we take the gallbladder out, we clear out those stones, boom, you're fixed. The jaundice goes away. Okay, that's obstructive jaundice. Hemolytic jaundice is different. That is caused by the excessive hemolysis of red blood cells. When red blood cells are hemolyzed, when they're destroyed, that is that releases bilirubin, okay? And bilirubin causes that yellow color. Now, we do this all the time, right? Because our red blood cells are recycled and everything. So, but the problem is if we've got excessive hemolysis, and we will learn about this in hemolytic anemia, okay, where your body itself is destroying red blood cells. Hepatorenal syndrome, you do not need to know, so just put a little X on this. This is just a little bit too much, okay? And basically, it's just your kidneys fail because your liver failed, okay? That's what it is, defined there. All right, I'm going to make this narration stop here, and I'm going to do a 3.5, since narration number 4 is peds, and we're going to pick up with hepatitis.